morning to both of you. Michael, I'll start with you. Your state, Tennessee, is involved in the pilot program in distribution of vaccines. Walk us through how your state is working through this sort of logistical rollout.
Thank you for asking. So the state is gearing up for the vaccine. We are very excited as healthcare providers because we do know that this will be truly a game changer for all of us, particularly the frontline associates. So the state is working through the governor's office as well as the THA, Tennessee Hospital Associations, working with all the hospitals in the state who will be the first recipients of the vaccine. Our goal is to make sure that we start off with the frontline associates, especially those that have pre-existing conditions, and making sure we that we're able to get them first, and hopefully that will help us as we continue to fight this virus.
Dr. Wheeler, the world needs as many vaccines as possible to end this pandemic. And till we get there, the positivity rate in your state of Minnesota continues to climb. I'm just curious, perhaps, even more concerning is the shortage of medical workers you're seeing. Walk us through what you're seeing on the ground there.
Yeah, you're right. Our geography in the Midwest, upper Midwest, has been seeing unprecedented numbers of infections and case growth. In Minnesota, our positivity rate is 15%, but in surrounding states, it's as high as 50%. And so we really are concerned about the case growth. And we know we're at unprecedented cases in our state right now. The hospitalizations are 3 times what they were in May at the peak. And we very much have, because of some help from the public, had enough time to get the protective equipment, the ventilators, and the space. But you cannot manufacture a talented and compassionate caregiver. And that's where we're having trouble with now, especially with so many of them being affected or their families being affected by community spread in our organization and in the community.
So following on that then, Dr. Wheeler, if things continue at the pace they are you not going to have enough healthcare workers to deal with the influx of patients?
Well, we're doing everything possible. Again, most of the healthcare workers are getting or being exposed to this with community spread. So one of our key messages is please help us on the community side of things. The need for masking, physical distancing, and washing the hands, all those things that I know people are fatigued, but so are the healthcare workers. And you can keep our healthcare workers healthier and able to care for you if you do those things. So that's one of the big ways in which we can actually keep our workforce healthy to care, because these are incredibly skilled people, and you can't replace them.
Shepard Smith here. Thanks for watching CNBC on YouTube.